This is Dr. Jerry Williams with Urgent Care 24/7 here to talk to you about an important topic. What do you do if you get a tooth knocked out? Really important that you handle this properly, so listen up. If you're watching this video, you're possibly in the situation where your child, your loved one, or a friend, or maybe yourself, you've had a tooth knocked out. First thing you need to do is find the tooth. So get the tooth and carefully pick it up by the crown. And the crown of the tooth is the part of the tooth that you see when you look in your mouth. Don't pick it up by the root, which is what's under the gum line. So you want to pick it up and you want to wash it clean. First of all, you should use milk. If you can't find milk, you can use water to wash it clean and get any excess dirt off of it. And now, if it's the case of a child, if it's a primary tooth, if it's a child's tooth, not an adult tooth, you want to not replace the tooth if it's a primary tooth. The only teeth that should be reinserted back into the socket are adult teeth. Now, if it is an adult tooth, you need to be really careful putting an adult tooth back in a child's mouth because they can swallow it. But if it's an adult or an adolescent and they've got a tooth that's knocked out, once you get it clean, you can either put the tooth back into the socket where it came out or put it between your cheek and your gum line and store the tooth there and immediately get to a dentist. The other thing you can do if you can't safely store the tooth in the mouth or it won't go back into the socket because there's trauma there, you can put the tooth in a container with saliva where the patient that had the tooth avulsed, knocked out, spits into a cup or into a glass or into a container and put the tooth in the saliva. Or you can put the tooth in milk. And they also make commercial transport medium you can actually buy to put a tooth in to transport it. So if you can't get to milk and you can't get saliva in a cup, you can't put it between your cheek or in the socket, you can go to a pharmacy and they may have these transport medium, but you don't want to wait. It's really important that the tooth not dry out. So you're going to go to the dentist and get to a dentist or to the emergency room or your urgent care center as quickly as possible. Finding an emergency dentist in many cities can be a big challenge, but what you want to do is you want to make sure you take the tooth as clean as possible and put it back in the socket if you can, or store it in your mouth. And what is the dentist going to do? Well, the first thing the dentist is going to do is that they're going to secure the tooth because the bone can actually grow back to the tooth. Now, unfortunately, the nerve and the blood vessels and those things, once the tooth's been avulsed, they're damaged and they're not going to come back. So any avulsed tooth is going to end up needing a root canal ultimately. But you can save the tooth by getting the tooth back in the socket, and by securing the tooth, the dentist will secure the tooth in place. It'll give the bone a chance to grow back to the base of the tooth, and you can end up salvaging the tooth. So anyway, I hope this information is useful. If you've been unfortunate enough, or your loved one or friend's been unfortunate enough to have a tooth knocked out, but really important that you act quickly, clean the tooth, and store the tooth appropriately. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe, and when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.